One of the things that really excites me about our show is getting to explore the stuff that's like quietly changing the world. And today, we're diving into something that's doing exactly that: AI in medicine.
Hmm.
You sent us this really thought-provoking article from LinkedIn, how AI is quietly reshaping everyday medicine and why it's not about replacing your doctor. And I gotta say, the title itself already got me hooked.
Yeah, it's a really interesting one.
So before we get into the nitty-gritty, could you give us a little overview of what the article's all about?
Well, it basically dives into this idea that AI, isn't this ominous force that's coming to steal doctors' jobs.
Right.
It's more like it's really about how AI can be this incredible tool,
Hmm.
like a superpowered assistant that helps healthcare professionals do their jobs even better.
Okay, so it's more about collaboration than competition.
Absolutely.
So where are we actually seeing this AI assistant making its mark in healthcare?
Well, the article gives a really cool example of AI in radiology.
Oh.
Yeah. Like imagine an AI working side by side with a radiologist,
Mm.
looking at tons of medical images. And, it can pick up on those tiny little details that a human eye might miss.
Like what?
Like a hairline fracture that's barely visible, or a really subtle shadow that could be an early sign of lung cancer, stuff like that.
Wow, that's pretty amazing. I mean, it's like having this extra set of eyes and digital ones at that are constantly on the lookout.
Exactly. And it never gets tired.
Right. No coffee breaks for AI. But the article did mention some pushback from some doctors, right?
Yeah.
I mean, is there this underlying fear that AI will eventually take over their jobs completely?
Well, there are definitely some concerns about job security, which is totally understandable. But what's interesting is that the article points out that AI is actually really good at handling all those tasks that many doctors find kind of tedious and time-consuming, like all the data analysis and the paperwork.
The stuff that keeps them away from patients. So it's kind of like AI is stepping in to take care of the administrative burden, letting doctors focus on what they do best.
Right. Connecting with patients and providing that, human touch.
I like that. So AI is freeing up doctors to be more human.
In a way, yeah.
The article mentioned an example of this in action, something called Dragon Medical One.
Oh, yes, that's a perfect example. It's a voice recognition tool.
Okay.
It basically uses AI to transcribe everything a doctor says into text.
Oh, so instead of typing up all those notes after seeing patients, doctors can just dictate them.
Yeah, exactly.
That sounds like a huge time saver. But how accurate is it? I mean, in medicine, even a small error could have big consequences, right?
You're right, and that's why the article emphasizes that, even with all this advanced AI, human oversight is still absolutely essential.
Okay.
So with Dragon Medical One, the AI does a really great job of converting speech to text. But, there's always the possibility of errors.
Yeah.
So a human still needs to review and make sure those records are completely accurate.
So it's not a hands-off approach. It's more like a partnership.
Yeah, it's all about finding that sweet spot where AI can boost efficiency and accuracy.
Right.
And then the human expert comes in to provide that final layer of validation and context.
Makes sense. So it's not AI versus doctors. It's AI and doctors working together.
Exactly.
Yeah.
But, as you might imagine, actually integrating AI into the whole complex world of healthcare, well, it's not always smooth sailing.
Yeah, I can imagine. What are some of the biggest hurdles hospitals and clinics are facing when it comes to adopting AI?
Well, I think one of the biggest challenges is simply that, change is hard,
Right.
especially in a field like medicine.
Right. Medicine's been around for a while.
Right. It has a lot of tradition,
Sure.
It can be kind of slow to embrace new things. So trying to shift those long-standing workflows and introduce new technologies, it can be a bit like trying to turn a giant ship around.
It takes time.
Yeah, a lot of time, patience, and a lot of trust building.
Yeah, I bet there's some resistance from healthcare providers who are used to doing things a certain way. And, maybe they're a little hesitant to rely on algorithms for tasks they've always handled themselves.
Absolutely. It's not just about the technology itself. It's about addressing, the human side of things.
The fears and anxieties.
Yeah, exactly.
Speaking of anxieties, the article touched on the fear of job displacement. Is that a valid concern, or is it more of a Hollywood hyped-up fear?
Well, I think it's a complicated issue. I mean, on one hand, there's no doubt that AI can automate some tasks that are currently done by humans.
Especially in those administrative roles.
Right. But on the other hand, most studies, even those by the World Health Organization, suggest that AI is more likely to, complement healthcare workers than replace them entirely.
It goes back to that idea of AI as a tool. It's
Yes.
like a powerful tool, but a tool that still needs a skilled human to use it effectively. So instead of completely replacing jobs, it might just change, the nature of those jobs, creating new opportunities.
You got it. It's about adaptation and evolution.
The article mentioned a survey by PwC, I think it was. It said that a lot of healthcare employees are worried about AI taking their jobs.
That's right, it did.
But it also pointed out that AI is creating new roles, too, in areas like, data analysis and algorithm development.
Yeah, exactly. And those roles require, different kinds of expertise.
It's a whole new world of healthcare jobs opening up. So as AI takes on those more routine tasks, it frees up healthcare professionals to focus on the things that really require that human touch.
Right. The empathy, the critical thinking, the complex decision-making.
All the stuff AI can't do.
Exactly.
So where are we actually seeing AI making a real, tangible difference in patient care?
Well, we already talked about AI streamlining documentation with, things like Dragon Medical One. But the article highlights a bunch of other areas where AI is really proving its worth, especially in tackling those tedious administrative tasks.
Oh, okay. The stuff that can really bog down a healthcare system.
Exactly. Like scheduling appointments, processing billing inquiries, all that behind-the-scenes stuff.
So it's like AI is stepping in as the ultimate administrative assistant.
Exactly. And by doing those tasks, more efficiently and accurately, it frees up healthcare professionals to focus on what really matters, providing, compassionate, personalized care to patients.
Makes sense. So instead of replacing human interaction, AI is actually creating more space for it.
That's the idea.
I like that. The article also mentioned AI being used to catch errors in medical records.
Oh, yeah, that's a really important one. Like, imagine an AI that can go through tons of patient data and double-check everything.
Making sure nothing's been overlooked.
Exactly. Looking for inconsistencies or, symptoms that a human might miss.
It's like having a superpowered proofreader for medical records.
Kind of, yeah.
Are there any real-world examples of how that's actually being used?
Yeah, definitely. For example, some hospitals are using AI to flag potential medication errors. Like if a doctor accidentally prescribes a drug that a patient is allergic to.
That's incredible.
Or if the dosage seems too high based on, the patient's weight or kidney function.
So AI is helping to prevent potentially harmful mistakes.
Exactly. And those are just, a few examples of how AI is quietly transforming healthcare, even if we don't always hear about it in the news.
Yeah, it's happening behind the scenes, making a real difference. It's clear that AI has a ton of potential, but as we've been discussing, there are also challenges to consider. I'm really interested to hear more about how healthcare systems can, approach AI adoption strategically and thoughtfully.
That's a really important question, and the article offers some great insights into the keys to successful AI implementation.
Let's hear it. I'm all ears.
All right, well, I think we should save that for part 2 of our deep dive.
All right, so we just finished talking about some of the areas where AI is already making a difference in healthcare, but I'm curious to hear your thoughts on the bigger picture, like what are some of the key things that healthcare teams really need to consider if they're thinking about implementing AI?
Yeah, that's a really important question, and the article lays out like a strategic roadmap for AI adoption. And one of the most important points it emphasizes is focusing on the full patient journey.
Okay, what does that mean exactly? Like in the context of AI, it sounds kind of abstract.
It means like thinking about how AI can be integrated across, all the different touch points in a patient's experience with the healthcare system.
Okay.
From the moment they first seek care to, managing chronic conditions or recovering after a hospital stay. So it's creating this seamless and supportive journey.
Got it. So instead of just focusing on like isolated applications of AI, it's about weaving it into the entire fabric of how healthcare is delivered. Could you give me like a concrete example of how this might actually work in practice?
Sure. Let's say a patient is diagnosed with diabetes.
Okay.
AI could be used to help create a personalized treatment plan,
Okay.
factoring in their medical history, their lifestyle, their preferences.
Right.
And then it could monitor their blood sugar levels remotely,
Oh, wow.
send alerts to their healthcare team if adjustments are needed, and even provide personalized coaching and support through, a chatbot or a virtual assistant.
That's pretty amazing. It sounds like AI could really revolutionize how we manage chronic conditions, by providing that ongoing support and really empowering patients to take a more active role in their own health. But of course, with all this data being collected and analyzed, data privacy and security have to be top of mind.
Oh, absolutely. The article's really clear about that. Protecting sensitive patient data is paramount,
Right.
especially as AI becomes more integrated into healthcare systems. So that means, robust security measures, complying with all the regulations like HIPAA here in the US and the EU's GDPR.
Right.
And, just building trust with patients
Hmm.
by being transparent about how their data is being used.
Transparency is key. Patients need to know that their information is in safe hands. The article also mentioned something called explainable AI. Can you explain what that is and why it's so important in healthcare?
Yeah, so explainable AI is basically about making sure that healthcare professionals understand how AI systems are making their decisions and recommendations.
Okay.
Because it's not enough to just trust a black box algorithm, especially when those decisions, can have such a big impact on patient care.
So it's not just about knowing that the AI is accurate, it's about understanding the reasoning behind its conclusions. Why is that so important for doctors and nurses?
Well, imagine a scenario where an AI recommends a particular treatment, but the doctor doesn't understand how the AI came to that recommendation.
Right.
They might be hesitant to trust the AI's judgment. Or, they might have trouble explaining it to the patient. And that can erode trust and, make it harder to make decisions together.
That makes sense. So explainable AI is really about bridging that gap between the complexity of algorithms and the human need for understanding.
Exactly.
It's about building trust
Yes.
between healthcare providers and AI systems, and also between patients and their care teams. Are there any other key ingredients for successful AI implementation we should talk about?
Yeah. The article highlights the importance of a collaborative culture.
Okay.
Implementing AI effectively in healthcare isn't just about the tech itself. It's about bringing the right people together.
So it's not just here's the AI IT department, you handle it.
No, not at all. It's about creating an environment where IT experts can work really closely with the clinical staff.
Okay.
Sharing their expertise to make sure implementation goes smoothly,
Hmm.
that there's effective training and ongoing support.
So breaking down those silos between the technical side and the clinical side is really important.
Yeah, definitely.
I imagine it's also crucial to get patients involved, to get their feedback and address any concerns they might have about using AI in their care.
Absolutely. Patient engagement is a huge part of this. It's about involving patients in the design and implementation of these AI systems from the beginning.
Making sure their voices are heard.
Exactly.
As we're talking about all this, it's striking me that implementing AI effectively and responsibly in healthcare, it's not just about the technology itself.
Right.
It's about all these human factors, the cultural shifts, the ethical considerations.
Yeah, you're absolutely right. And I think this article does a great job of reframing how we think about AI in healthcare.
Hmm.
It's not about replacing doctors with robots. It's about using AI to make the human connection even stronger.
I like that. It's about using technology to enhance our humanity, not replace it. And it brings up this question that I've been thinking about. Where do we draw the line? What are the things that AI simply can't do? Those aspects of healthcare that will always require human empathy, intuition, and compassion.
That's a really profound question, and one that I think we'll be wrestling with for a long time as AI continues to evolve. The article touches on this a bit, talking about the limitations of AI when it comes to, understanding and responding to the full range of human emotions.
Right. Because AI might be able to analyze symptoms and recommend treatments, but can it really grasp the fear and uncertainty that a patient feels when they get a difficult diagnosis?
Right.
Can it offer that comfort and reassurance that comes from a genuine human connection?
Those are the questions we need to keep asking ourselves.
This has been such an eye-opening conversation. It's clear that AI has the potential to revolutionize healthcare, but we have to be really thoughtful about how we use it.
Absolutely. We need to make sure we're using it to enhance our humanity, not replace it.